Hi, my name is Dr. Vlahos from Antioch Dental Care, and today we're just going to have a little chat about how to keep your teeth for a lifetime. And we're going to discuss what we go through when you come in for a cleaning. One of the things that we focus on is periodontal disease, um, what the probings are, and we'll tell you, and I'll show you what a probing is. How do we treat periodontal disease, and what are the consequences of non-treatment? Okay, here's a model, and side we have very healthy teeth, and the other side we have unhealthy teeth. Healthy teeth and gums, and unhealthy teeth and gums. And here's a probe, okay, and basically along with x-rays and clinically looking at your gums and teeth to see what condition they're in, one of the things that we do is use this probe to help us in diagnoses. So what is periodontal disease? Periodontal disease is basically unhealthy gums and unhealthy bone around the teeth. When you have unhealthy gums and unhealthy bone around the teeth, we have consequences. And one of the consequences is down the line we can lose our teeth. So this probe will help us determine the health of your periodontal tissues, the teeth and the gum. And let's start first by looking at a healthy tooth and healthy gums. Okay, here we have a healthy tooth and here's a healthy gums. We put this little probe, gently put it in here, and we can see by the markings it's about 2 millimeters. And that's about normal because when food gets lodged in here, by brushing and flossing and rinsing, it washes away any food particles, any bacteria that accumulate in this area. Okay, because this probe pocket is shallow, 2 to 3 millimeters, and we probe, there's no pain, there's no discomfort, it doesn't hurt. We know that it's shallow and it's easily cleansable. So when we pull back the gums here, we can see that the bone is healthy and that the tooth is healthy. Now we move around to this side. Okay, and we can see the gums are puffy, and when we probe, we go down, we go, instead of 2, 3 millimeters, this thing goes down quite a bit, 5, 6, 7 millimeters. We know that when it's this deep, food particles that get inside here cannot be cleaned. So the food particles stay, and one of the consequences is, you can see here, compared to here, we lost a lot of bone. And the teeth get loose. Now sometimes there's no pain or discomfort, but here's what we see. When the teeth get loose, eventually you end up losing all these teeth because of the bone loss. Now how do we treat this? Okay, so when you come in, we measure the pockets, and if we see that there's bleeding around the gums, and if it's greater than, let's say 4 millimeters, 4 or 5 millimeters, what we do is we give you a little anesthesia, we numb the gums, and we clean around this pocket. We go down with instruments and we clean it. And when it's clean, the gum tissues want to go back and become healthy, and the pocket depth stops increasing. Okay? If we find that the pocket depths are too deep, 7, 8, 9 millimeters, sometimes we can save the teeth, but you probably need periodontal gum surgery. Just cleaning around the teeth won't do it. So we usually send you to a periodontist. So when you come in for your cleaning, we measure all your pockets. We make sure that we focus in on the ones that bleed and have a depth about 4 or 5 millimeters, because we know we can help you with those teeth. The deeper pockets, they're more difficult to treat, and the results are not as guaranteed. So anyway, that's a little chat on periodontal disease. I hope you kind of understand what a periodontal pocket is now, what is probing, how we treat it, and the consequences of not treating.